Today, it is harder for Dr. Shetty to convince a patient that he doesn't need heart surgery than it is when he started on his career that this person needed heart surgery.
What's the Narayana DNA? Like, what makes you successful or superpower per se?
Everything is interrelated because we defined ourselves that this is the sort of place where we'll treat everyone. It doesn't matter. We won't turn anyone away. Which meant you engineer the systems a little differently, which in turn means that you attract a group of people who aren't motivated solely by a profit motive, but for those who want to do something a little extra.
I'm Pankaj Jethwani, the managing partner at W Health Ventures and a venture studio at 2070 Health. We found and fund first-to-market healthcare companies in India, for India as well as the world. We're excited to bring to you the W Health podcast. This is a series of conversations with global leaders that have built market-leading and impactful healthcare companies. Through these conversations, we'll try to uncover unique insights that have helped these organizations scale and become successful. Welcome. I'm excited to have Viren Shetty, the Vice Chairman at Narayana Health, which is one of India's largest publicly traded healthcare companies. Very excited to have you, Viren. Thanks a lot for your time.
Thanks, Pankaj. Glad to be here.
Viren, would love for you to share a little bit about Narayana Health.
Yeah. So let's take us all the way back. We run hospitals all over India. We were started by a group of doctors, cardiac surgeons and cardiologists mostly, with the idea that Indians are hugely susceptible to heart disease and die at very young ages and in alarming numbers because of heart attacks. And there's a general lack of access to safe surgery. And when they started looking at the reasons why people get heart surgery, they realized it's very expensive. And so they said, let's build an organization that tries to make the process of doing surgery and angioplasty much more affordable. And the way in which they did that was to apply standard business thinking, economies of scale, certain process efficiencies, just in time. And they were able to be quite successful doing just one specialty. And before they knew it, it expanded to the entire range. And the model was successful enough, we were able to expand across India and even outside India. And we just take shamelessly every trick that can be applied in any other business and apply to healthcare, because we believe that this business, it's not sacred. There are no holy cows in it. You can disrupt, you can change, you can alter the way people, whether it's doctors, nurses, customers, administrators, behave to drive much more value for our customers.
Yeah, no, as a physician growing up in India, we had several clinical role models, right? There were good surgeons and physicians in every city. But myself and a lot of my peers, my friends included, kind of idolized Dr. Devi Shetty, the founder, not only because he was a great cardiac surgeon, obviously, probably done the most number of heart surgeries in the world. And I think what resonated more was the vision that seemed so meaningful and so difficult at the same time, right? So we grew up in a generation where this was just starting to happen, and there was just starting to be conversations about this. And okay, it is possible to build meaningful healthcare businesses at scale. And I think that's been we've looked up, a lot of physicians like myself have looked up to what NH has been doing over the last few decades. So how long has it been for you at NH? It's been a couple decades now?
For me, yeah.
Wow.
I started working part-time in college, so this was in 2004. So nearly 20 years
Wow.
I've been at the company. And to the point you had read earlier, which is why people look up to us, is that we've stayed consistent. And Dr. Shetty has never given up on the dream. Oftentimes what happens when you start a company, you start with great vision, you start with great clarity, and then the market forces, the reality, your unit economics just hits you like a ton of bricks.
Yeah.
And companies pivot, they change, they fundraise, they change their direction, they change their strategy, everything changes. But we've been fortunate in that we've never had to give that up. We will change what we can, but we never give up on what every doctor gets into medicine to want to do, which is treat patients, treat all patients, regardless of whether they can pay or not.
Yeah. I read the statistic somewhere, which was you probably have, I don't know, 0.5% of all hospital beds in India, but you end up doing 15-16% of all heart surgeries. Are you even present in so many cities that you have 15% of the population come to you for heart surgeries?
And that's for many reasons. One is, of course, that 33% of our business is still cardiac focused.
Yeah.
Most people don't do it. A lot of even larger multi-specialty groups tend to defocus cardiac surgery because it's very complex. It has very long stay. You tend to draw from a very representative sample of the Indian population, which is a fancy way of saying lower middle class and poorer people. When a lot of hospitals, when they're trying to move up the value chain, they say, you know what, you don't need that business. It's highly driven by scheme, highly driven by government payers, highly driven by people that cannot afford to pay. And so they start doing consciously lower and lower volumes of heart surgeries. Whereas for us, we realize that this is a huge problem and there's nowhere else for them to go. And we want to be the place where these patients go.
You mentioned that the steer has always been to be true to the mission that you set up with. And that has meant that you've taken seemingly to the market completely contrarian, like long-term bets in building the business, right? And through this conversation, I'd love to understand the why behind some decisions that seem fairly unusual. And but before we get there, like what's the Narayana DNA? Like what makes you successful? What's your superpower per se?
I mean, there's a lot of things. I would say the mission that we never deviated from, which is that we will be affordable, we will be accessible to as broad a swath of the population as we can achieve, has meant that we're engineered a little differently. The incentives are built a little differently, and that tends to attract a very different group of doctors and administrators and nurses and technicians to come work for us. So I would say everything is interrelated because we defined ourselves that this is the sort of place where we will treat everyone. It doesn't matter. We won't turn anyone away. Which meant you engineer the systems a little differently, which in turn means that you attract a group of people who aren't motivated solely by a profit motive, but for those who want to do something a little extra. It doesn't mean that we're underpaying people. It doesn't mean that people work for us for free. What it means is that you work here and you get to stand for something much more than the day-to-day work. So I would say that the superpower, if there is any, it's more a sense of shared mission and purpose. And it doesn't mean that we're the most profitable hospital, or it doesn't even mean that we are performing at the best infrastructure or the best of everything. It just means that we stand for so much with the patients who come to us because they know that they can trust us.
And I think that itself provides a lot of competitive benefit over time when people are with you for a sense of purpose along with the financial incentives that are within healthcare. What was it like growing up in a household where you saw Dr. Shetty try to build this organization from the ground up? Like what were like dinner table conversations, or what are some things that are like deeply instilled from a value system perspective?
Audaciousness was the key one. In terms of Dr. Shetty's career, was relatively recent. He spent a good 20 years before that working in England, Calcutta, and another hospital in Bangalore before that. So it didn't matter at which stage of his life he was. He always wanted to do more. He wanted to be more. He wanted to keep stretching much well beyond the constraints in that little box that he was put in. If it was one hospital, he would dream of 2. If it was 2 hospitals, he would dream of 10. If it were just one operating theater that he was given, he would say, no, I want to control all the operating theaters. And so the dinner table conversation was always about how much more we could do. We talk about, I can do this, I can do that. And a lot of it did not exist. It was just him sort of envisioning a thing that could happen. And sometimes it would manifest, sometimes it wouldn't. But the running theme in all those conversations that we had was that we can do more. And it is our duty to do more.
Yeah. No, that's incredible. And one story that I had the good fortune of having breakfast with Dr. Shetty last year in Bangalore. And his team reached out saying, look, can we do breakfast at 6 a.m. because Dr. Shetty has to operate. I was like, of course. I was jet lagged, so that helped, coming in. And I got in at 5:50, thinking, okay, I'll get 15, 20 minutes to do my email, and I see like it's complete darkness, and there's this man walking in the veranda. And I go closer. It was Dr. Shetty. I was like, why are you here so early? He's like, oh, I've been here 20 minutes. I was getting my morning steps in. So what gives him the energy to, I think maybe that's also part of the success. Just like heads down, in his 70s, still being so hungry and still being so, the work ethic talks for itself. So
Yeah.
Yeah.
Look, I mean, the world is filled with dreamers. There's any number of people who can envision and say, yeah, let's make
Yeah.
grand strategy and change the world and all of that. But none I've seen achieve it without phenomenal stamina.
Yeah.
Like, Dr. Shetty's work ethic is legendary.
Yeah. Well, over a decade ago, you took another contrarian bet, right? You started investing significant chunks of money in building a technology team, like hundreds of engineers silently building product. And that was contrarian to popular belief that hospitals should not build their EMRs, right? There are companies who do that well. There's a reason for that, right? It's talent, it's focus, it's scale, funding, all of that. And obviously, 10 years later, there are enough proof points on why this decision made sense back in the day. And you were a proponent of pushing this, back in the days. What gave you the conviction, and what made you convince the board to make, these investments? Because it came at the cost of opening a hospital a year, right?
So even though we took this call 8 years ago, I feel even at that time it was probably too late a decision. But it took us the first 12 years of our company to figure out that this is what we needed to do. You're right. It did not naturally come to us as a healthcare operator where you build a hospital, you staff it with doctors, you do nurses. That building software is either a necessary requirement or a skill or something that we should do. And so we cycled through 4 different vendors prior to that. We'd say, okay, EMR, take something off the shelf, do some tweaking, make some adjustments, get it done. Okay, it works. Great. Spend some time in training. And then you keep doing it until we find, invariably, after a couple of years, we would find this happening where the vendor could no longer support the scale of our ambition or could no longer program it to achieve our business objectives. And then fine, okay, it's done. New RFP, new tender, get some new vendors on board and start all over again. And we did this 4 times. To which point we said, this is ridiculous. This is fundamentally a broken system. Now, I could go to the best vendors in the world who make the best EMRs, but what if in 5, maybe it takes longer, maybe it takes 6, 7 years, I end up in the same place where my business objectives have far outpaced the capabilities of the software. Who do I go to then? And so we paused, we took a step back and we said, okay, no, this does not work. I cannot. Is this important for our company? Yes. Is this important for any modern organization in the world, which is having a digital strategy, having a huge business support team comprising of developers, product managers, data analytics, AI engineers now? Is it important to have that in a modern organization to support the business objectives and to provide either a great experience for your customers, to deliver things more efficiently, to automate certain functions? Yes, every modern organization has this. Is healthcare any different from any other organization? We've always believed no. So then there's no reason why we shouldn't do what Home Depot or Ford Motor Company or some lighting company does.
But like this realization is not unique to you, right? I'm sure there are 20 other large hospital systems in India with the same realization that the solutions, the vendors, it don't work, and then many of them eventually also make bets. But what has made this endeavor, like, what have you done differently? Because it's hard to get people on board. It's hard to keep them motivated. It's hard to know what to build, how to build better than the vendor who's doing this, for decades and with thousands of people. So
I would say the biggest difference, I won't say that it is a better call. A lot of companies take a different call from us and maybe it works out better for them. But this is what made our call with digitization different, was we completely ripped out the existing system and replaced it with a new one. Whereas most other healthcare groups, when they do, they say, no, don't touch anything. Let it all be there. Just keep things going. I don't want any business disruption. And so the substrata of the system that exists, that does not get touched. Whatever you want to do, you build on top of that. And it's fine because it will achieve the business objective that things don't get disrupted. But what you realize is that you have a foundation made of sand. And the more things that get piled up on top of it with other organizations, it adds to technical debt. It adds to the complexity of figuring out how data interoperability looks like. I mean, there are entire companies, which I'm sure you guys have invested in, built on top of serving that essential business requirement, which is don't touch what's there, just add an add on top. Whereas for us, we said that's not going to work. We are young and immature enough in our company, we can afford to take a step back from investing in infrastructure, from investing in new expansion, to invest in technology, that we will use that to drive business performance instead. Every foregone bed, every foregone doctor that we could have hired, every foregone city that we gave up, we will create that through the efficiencies of this one fully interoperable, full stack healthcare solution that we built. And this will pay dividends for years to come. It's a theory, right? We're still very, very early on in that. And it has paid out well. Like, we've been able to grow. We've been able to achieve several of our business objectives just without having to add more beds. So it was the right bet. I can understand why a lot of healthcare organizations would not take that call. It's simply too big a bet to make. That it has worked out for us doesn't mean it will happen with anyone else.
And is it an aspiration to also be a healthcare software company for the world?
Our aspiration is to be a healthcare provider to the world. The software is the enabling layer of that. So healthcare delivered through software, healthcare delivered through doctors, it's just healthcare delivered. And so we've built an incredible hospital operating system that comprises of multiple layers. It would be a shame if we did not share that with people who were interested in it.
Yeah. I've had the fortune of peeping and looking at some of the stuff you've built. What is the one feature that doctors love the most, that they're like, thank God you built this? And you built thousands of these. So what is the one thing?
See, the trade-offs are there. Now, for example, the ability for the doctor in one common unified view to be able to both order test, to be able to go through the history, to be able to open up all the things in one window, I think they find the most useful. Whereas most other systems, when we're running 3 concurrent systems, they have to switch between multiple tabs. And the data doesn't always work then because we need to be compliant to a higher degree of security. Each one tends to have their own logins or so on. So the fact that we can provide a universal view, both on the desktop as well as their phone. And so a lot of them are fully desktopless. So they manage most of their ICU rounds, they manage most of the tests, a lot of the ordering can happen on their phone. So just providing that one unified view of all of that makes them very happy.
Moving gears a little bit to another contrarian bet you made, right? 10 years ago or so, you all built a hospital in Cayman. Why Cayman? Why? I mean, and 2 things. If global, then why not the Middle East, where or Sri Lanka or Bangladesh? There's so much happening at that point in these parts of the world. For Indian providers to go and set up shop, why, 30 hours away in Cayman, and why not just double down in India, given the large unmet need here?
Yeah, and my investors ask this all the time, so I'm very well prepared for the answer. We're not giving up necessarily on India. India is the fastest growing, the most exciting market for healthcare in the world today. The investors are really keen on the Indian market, and just, our results have shown that we can do quite well here. This was everything but that. Our ambition was always to do more, to be more. And any Indian company that you see, how they achieve that global status is by being a multinational company, where you can marry, either the work ethic, the system of working, the arbitrage of having people here across multiple time zones, or being able to use this large market to build a set of competencies that you can then leverage in other markets, whether it's IT, manufacturing, whatever it is. That's what the story of Indian companies, when they go multinational, is be strong here, but also pursue other foreign opportunities. And Cayman wasn't the first. We did try something in Kenya. We did try something in Malaysia. We had projects in Oman. We had clinics in Bangladesh. So we were sort of multinational before that, but Cayman, of course, was our biggest, largest, our most audacious bet. Because we were convinced that the work that we do is immense. The sort of value we provide to our customers. Today, the Indian patient, on a adjusted basis, pays the lowest amount for healthcare compared to not just anywhere in the world, even anywhere among the peer countries. If you adjust for the purchasing power parity, what an Indian customer pays for very high quality healthcare is less than what they get in Thailand, Indonesia, Malaysia, Singapore. It just goes without question. Like, there's a huge amount of work to provide a service that is of great value. Now you just take the same thing and apply it to a country where it's priced orders of magnitude higher. It doesn't mean that your cost base should increase orders of magnitude more. Just the only thing that will scale like that is salary. Everything else shouldn't. Because in India, we pay the same, roughly the same for drugs, for the medical equipment, for all the other consumables, for the infrastructure. Our infrastructure costs only about half to a quarter of the US, but the reimbursement is 10 to 100 times different. Yeah. So you wanted to go after the US market. But we were not convinced enough that we had what it took to be a US healthcare operator. So we partnered with a US healthcare operator and said, look, let's try to recreate a US type hospital in the non-US geographies. And Cayman was, 1 hour flight from Miami. It had international standards, UK jurisdiction. So let's try and create that. Let's see if we can make it work in this place. And we did. And so that's why Cayman.
Why did they partner? What was their decision framework?
Our US partner was Ascension Health. Ascension Health is the largest nonprofit healthcare operator in the US. They saw the same thing that we saw. They saw that there is a scope for doing tremendous amount of innovation. And when we set up, we had, I kid you not, for a hospital, that is a rounding error for Ascension's balance sheet. We had their entire top leadership come in 4 times a year to sit with us, to understand the operations, to look at how we did supply chain, how we processed the patients, what we did on technology. They were deeply, deeply interested in what we were doing to see if they could apply it to their own system. Because they also operate in a very large federal network where they don't exert a lot of central control the way Indian healthcare operators do. So for them, they saw this as a very different way of running hospital and lessons that they could apply to their own business. But the initial thesis that we had with this hospital was that we could bring a whole lot of US patients to come in who are paying very high prices in the US. If the insurance doesn't cover it, you could send them to Cayman. It can be done at a fraction of the price. That was the theory. Both Ascension and us strongly believed in that. We spoke to all the major employers in that part of the world. They all agreed with it, but they were not able to get any patients to come because healthcare is deeply personal. People don't want to travel very far. And it turns out that healthcare is a very emotive business. It's not one that operates entirely on facts and numbers. So eventually they lost interest in the business because they were not able to, leverage that for their existing network. And so they sold the business to us.
Yeah. How long back was that?
This would have been 2017, 18, I want to say.
And now you have a fairly large local market share of the Cayman healthcare market. You're doing over $100 million in revenue there in that hospital, and it's hugely successful. Does this open up ambitions for finding newer Caymans for the business?
Our investors ask this as well.
Yeah.
And I'm also prepared for the answer.
Yeah.
The simple answer is yes. There are enough developing markets within India. India within it contains an Indonesia and Africa, the CIS countries, they all exist within India. So India will remain our primary focus, but we want to try to find other Cayman-like geographies that have a couple of things going for them. One is stable currency, rule of law, very well-established, sclerotic, badly functioning healthcare system where the kind of operation improvements we bring have a multiplier effect on how efficiently or profitably you can run a healthcare system. And so that is our thesis. So the markets we're looking at are things similar, Caymanish, like all in the Caribbean, all these UK administered territories, all the places like that. So developed countries, we believe that that change that you expect in normal healthcare services, only an Indian healthcare operator would be able to operate at the transformational level of efficiency. Because it's not just labor arbitrage, what people say. It is a very different way of running businesses.
And the earlier experiments with Kenya or Malaysia, like they didn't pan out as planned for you?
Yeah.
Okay.
So one of the biggest challenges that most countries have is the zero portability of manpower. The challenges in Kenya and Malaysia was that you cannot bring foreign doctors in. In Kenya, there aren't that many local doctors available, and it's very hard to bring foreign doctors in. So that was one major challenge. We thought simple labor arbitrage could achieve that, which is bring a bunch of very high-skilled doctors to come in and operate. But that didn't turn out to be the case. But also, we were not able to get adequate funding for the project, and so we didn't. With Malaysia, it was the first part. It was just that we came in with at that time, Malaysia didn't have anyone doing very high-end pediatric cardiac surgery, pediatric cardiology, and so we thought we would bring those skill sets in to our partner, which was Columbia Asia at that time. But during the course of us getting it set up, the rules changed and put further blocks on our ability to bring it in. And so we gave up on that.
Why have Indian hospital operators not used this playbook of building in Western markets? Obviously, you have the likes of Aster who've done a phenomenal job of building a compelling Middle East business as they have in India. But more Western markets, why have the scaled Indian healthcare operators stayed away?
In one way, you don't need to, right? Just look at the size of the Indian market. It's growing at the fastest pace in the world. You simply don't need to. And in India, there are two drivers of the healthcare consumption. One is the population itself going up. So you have, one level of growth. And then each person, as they get older and more affluent, starts to get more procedures done on them. And so it becomes exponential sort of growth. So theoretically, and there is a case, a lot of investors who question our attempts at going out saying you're being distracted because you're not looking too hard at the Indian market and your competitors are growing much faster. And they're right in one way, which is that you can grow much faster in India. But we're saying no, we can do both. We need to be able to do both because our ambition is not just to scale linearly. Our ambition is to scale exponentially, to build a Marriott, Starbucks, American Airlines. Like, what is the franchisable way of running this business that can scale exponentially, where there's a standard playbook of this is how you run a hospital. This is the tech. This is the box that you need to put in. This is the exact dimensions of a room. These many doctors, these many nurses. Now build it infinitely. Because right now, construction takes 3 years. Break even takes a year. Then it takes another 4 or 5 years to get to a cash flow break even. It's just ridiculously long. And the need is immense, and the cost needs to go down by an order of magnitude. So we're just trying to build a very different playbook.
Yeah. And switching topics a little bit, but one of the other audacious ambitions or goals you have is around health insurance. And it's not the first time, right? We've had other large hospital operators in India dabble in health insurance. But the playbook was that they used was similar to what was market norm at that point. And your playbook seems to be different. Like what's the history? What's the genesis of what you're trying to do in insurance?
Yeah. We were always interested in health insurance, but to do it very differently. Dr. Shetty was one of the pioneers of a concept of microinsurance. The idea that you collect small groups of money from a very large pool of people and you use it to reimburse for catastrophic procedures. And so he built it in the cooperative model. He partnered with the government cooperative societies, collected money, small amounts from everyone, put it into a pool. The pool was self-managed by the trustees of the cooperative society, which is government representatives and himself. And we would do a good job of finding a limited set of providers we could work with to be able to identify the patients, those who needed the procedure, and get it done at a very competitive rate. So this was always the plan with us. Unfortunately, the cooperative system, it got co-opted into the overall government, what today is now the Ayushman program. It stopped being what we wanted it to be. It stopped being insurance, it stopped being cooperative based, and it stopped being limited in nature and catastrophic in coverage. And so it just became like US Medicare, fee for service, cover everything, empanel everybody, which is fine. I mean, that's one way to achieve universal health coverage. But he never quite gave up the idea that we need to do something very different, because healthcare services and health insurance, our fates are intertwined. Our growth is their growth. Their growth is our growth. And it is sad with the amount of work that we put in running our hospitals, where a lot of the customers who have insurance, their experience in a hospital is completely destroyed by the inadequate coverage that they have, or they're not being able to get good explanation of what they're entitled to or not. So we knew we had to run it a little differently. And so we do what we usually do and copy the best playbooks around the world. And the playbook that we were quite inspired by was the one of Kaiser, running a HMO, integrated care, or these Brazilian cooperative societies where every member is part of a plan that covers clinic and hospital access. So we can do that here. Now, the law is not structured to allow that. In those countries, HMOs are a separate category of health insurance. That doesn't exist here. So we had to apply for a traditional health insurance license. But fortunately, the regulator today is extremely proactive. And they're saying, we want experimentation. We want different sort of models. And so we built it to be narrow network, limited in scope, limited in coverage, but something where once you are in, there's no questions asked. Your healthcare will be taken care of, no exceptions. If you're within the network, almost everything is taken care of. Now, why it is different from what everyone else did? Everyone did traditional health insurance. So health insurance in India is traditionally sold like general insurance or life insurance, which is you empanel a large distributor network, you go about and you sell. You're in the business of selling policies. You're not in the business of providing healthcare. For us, we think about health insurance as this is just the business of selling healthcare, but I'm collecting money upfront and I'm collecting small amounts of money over the course of your life. And the healthcare part, we'll take care of it.
What you mentioned, limited scope, limited coverage. What do you plan to not cover versus, me buying insurance from somewhere else?
So today when you buy, if you compare our plans side by side, for the one is our pricing is very competitive, but you can't just go to Policy Bazaar and buy it. You can't, there's no large broker network. You have to come directly to us. We will do a thorough checkup for you, like an actual come to a center, get a blood draw. If you come within certain risk category, even get a CT scan. And all of that is covered. The pre-medical checkup is actually done. Most health insurance companies don't do that. They just give a form that you tick. And a lot of the times, the brokers of these things, they facilitate that fraud because they just want to make the sale. So even if you have a pre-existing condition, they say, no, just say no. It'll be fine. But the policyholders are stuck because tomorrow when they make a claim, they find out there's something pre-existing and they get denied. So that's one major difference. The other is that you are limited to a narrow network where everyone else says, no, you go wherever, cashless anywhere, 5,000, 10,000 hospitals. And so you're restricted to a small amount. And the other one is the exclusions are stated upfront. And for the lowest end plan that we have announced, there is for certain medical procedures a 2,000 rupee a day copay. And so that is not what most health insurance plans have. They don't have a copay system. They have, I'll cover everything and then I'll look at how much I can deny you system. Whereas we state upfront, this is how much you're going to have to pay, but everything else is taken care of by us.
Yeah. And the narrow network is mainly NH facilities, or you?
For now. Eventually, we want to be able to empanel a large number of like-minded healthcare operators who also believe in the things that we believe, which is not doing unnecessary procedures, not, offering things that the patient does not necessarily require. Yeah. See, because most hospitals have massive utilization problems. We have this huge upfront investment we make in the infrastructure and the doctors, and they're just sitting around waiting. If I'm able to assure them a set amount of volume every month, they'll be very happy to agree to being paid upfront based on a volume guarantee rather than a fee-for-service model. And so for now, we'll start with our own network, but over time, we will gradually start empaneling other healthcare groups who believe in this.
Yeah. This also incentivizes you to take care of a patient more holistically with a long-term view versus a let me operate today and make my 2.5 lakh rupees today.
That is the only way this thing will work. So whatever we end up saving the customer in terms of not going with, so today if you go through a broker, there's 35 to sometimes 60% commission that you pay out. So we do direct, so maybe it's only 5% that we pay our sales guys.
Yeah.
The thing that we save, we load it all on services. We will give them a wonderful experience. We will take care of them proactively. We will get their blood tests done. We will get their scans done. If they have some issue, we will take care of it.
Yeah.
With the idea that, one, you have a much better overall experience with health insurance. And the other is that we get to delay, extend, or even prevent any avoidable heart attacks tomorrow.
Yeah. With the HMO model in the US, one of the big criticism is there's always a gatekeeper for care, right? It might be a primary care doctor, etc. Is that going to be the same model that you apply?
It would be, see, that's why we know that this is not something that everyone would prefer. There is some group of patients, and maybe even the majority of patients still in the US prefer traditional health insurance. So they're more likely to buy a Blue Cross or United plan than they are likely to buy a Kaiser or Intermountain plan. We're fully accepting of that. This does appeal to a niche. This does appeal to people who maybe are not happy enough with traditional insurance. And we know that in any market, we may not cross, even at its fully mature state, we know we may not cross a quarter to maybe a third of the potential insurance pool. So there will be gatekeeping. Of course, this has to work with gatekeeping. But it's not gatekeeping in the sense of I'm denying you things. This is gatekeeping in the sense of I'm the one who's proactively reaching out to you and telling you and asking you what is wrong, what are the things we need to take care of. And these are the best resources that will be able to take care of that issue that you have.
So a quarter or a third is an audacious goal. Again, right? It's quite concentrated an expectation.
As a hope. So the other one is that we would run in very few cities. We wouldn't go for national coverage. We would make sure that only in areas where we have a good amount of coverage with our own network or partner networks would we go. So nationally, this may not even be single-digit market share, but in the cities that we operate, we want to have dense concentration.
And you're starting with Bangalore, Calcutta?
Starting with Bangalore and Calcutta, but eventually we want to be in all the cities where we are active.
Okay. What does success look like in 3-4 years for health insurance?
Health insurance, 3-4 years is very. It's our business is one that operates on decadal time frame. So 3-4 years. Okay, I would say at least we would like to have a couple of lakh policies sold, and more than anything else, the customers who come in, whether they keep coming back to us, whether they tell their friends and family and say this is an amazing plan, this is something that you need to sign up, so we don't have this huge cost of acquiring new customers and it becomes more organic, and that we're able to actually change health outcomes. So there is this South African group called Discovery Health, and they were the first to pioneer this program of proactively reaching out to their customers and putting them on, diet plans, weight loss, exercise, and they call that program Vitality. And they said easily when they go to companies to pitch it, when they go to other insurance companies to say, try this Vitality program, they say easily there is a 10 to 15% reduction in the claims than if you just leave your customers entirely unmonitored.
Yeah.
So if I'm able to achieve, at bare minimum, we think we can do much more, but at bare minimum, if we can get a 10 to 15% reduction in people falling sick, then we know that we're successful in this.
Yeah. And will your target audience skew younger, older? It doesn't matter.
The insurance market in India tends to skew older. We're hoping to be able to reverse that, but we may not be able to initially. I think our starting cohorts of patients will be older, will be sicker, will be ones who have traditionally gone and bought insurance or have accessed healthcare at our facilities. But over time, we will start opening it up to a much younger audience.
And you'll be able to risk adjust these people well because you're thoroughly evaluating them.
We are thoroughly evaluating them, and we will keep them. Even if we cannot offer them insurance, if they have a major condition, we can still offer them health management services. It's not insurance per se, but so if someone has some sort of kidney dysfunction, or if they have liver disease, or if they have some heart disease, we say, look, why don't you sign up with us for a 1-year plan? And in that 1-year plan, it's not insurance. It includes a sum total of all the medicines you will anyway take, the scans and the doctor appointments you will anyway take. And it comes to you a lot cheaper because it's all bundled into one package. Let me monitor you for a year. And in 1 year, We can't do it yet, but eventually in 1 year, we will be able to figure out if they're insurable, if there's a quantifiable amount of risk with some loading that we can take and say, fine, now you've established that you're a person who follows protocols, takes the medicine that's required, or go for any lifestyle modification. So it's worth taking the risk on you. And with a much higher odds that they will have that health incident that we plan for, but if it can be pushed out a couple of years, then the underwriting model makes sense that they're worth insuring.
Yeah. What's the most optimistic loss ratio you expect from this business in Bangalore?
The thing is that we have a very talented, very enthusiastic set of people doing the underwriting for us, and they projected better than industry loss ratios. Me personally, I have a much more realistic sense of the way in which you will skew towards a sicker population. So my guess is our loss ratios initially will skew higher than industry average, but over time it should moderate, whereas they are saying the exact opposite.
So stepping a little bit away from insurance, you have a hands full with India expansion, with global expansion, with this audacious goal of health insurance, that is, a multi-decade plan. If you had unlimited bandwidth as an operator and resources available, what are a couple of businesses you'd want to start within Narayana that you're probably not doing right now?
I think there will be in phases and only for certain departments, but it will happen at much greater frequency. A large-scale shift of a large number of procedures that traditionally happen in these large hospitals, 200, 300 bed, 500 academic medical center type institutions, towards much smaller, focused centers. So the fastest growing field in mature economies are daycare centers, retail health centers. Just a lot of things are moving away from the hospital. In India, still, too many people have a hospital-centric view of where I need to get care, because it is the concentration of trust. Because the hospital is a place where there's a concentration of where the best talent is, where a lot of the patients are coming anyway, where the doctors prefer to work. And so it tends to work in this very clusterized approach. A big reason why we invested so much in the technology also is that if we're able to solve the interoperability problem and the coordination issues that come with running multiple centers, where if you're all running one system, it becomes seamless for the doctors and seamless for the patients. We would then be able to be multi-locational and not have everything concentrated within four walls in one place. So if I had a lot more bandwidth and money and patience, I would definitely invest in, I wouldn't call it daycare centers. I mean, that system has been tried in India, but I would say a multitude of formats that are smaller, bigger, that are much closer to where people live, that operate a range of healthcare services. So,
yeah, ambulatory surgery centers in the West is obviously it's an industry that's growing for the last 20 years for some of these reasons, right? There's peer pressure, right? Like this surgery should not happen in your 1,000-bed facility where, what else would you build?
This one,
I'm doing cheap idea generation for a venture studio. So yeah.
I think there is this system we're trying out. We're calling it the Shared Services Center. I think there are tens of thousands, if not lakhs, of doctor entrepreneurs out there who have it in them, who don't want to work within a large established health system and be a nameless cog. They want to set up their own clinic, nursing home, daycare surgery center. But one, they lack the capital, obviously. But even if they have the capital, they just don't have the conviction that they can run it themselves, because it's such a pain in the ass to get all these things put together, to do hiring, to do accounting, to collect your payments, to settle bills, to deal with the minutia of the day-to-day ops. So what we're trying in our system, and hopefully we'll be able to offer it as a service out of the box for anyone, is everything but the touching the patient part of the business. Everything else, if it can be extracted away and turned into a set of services that is either done remotely, either automated or digitized, or just done like a SaaS service as a SaaS business where we take care of all of that.
Including capital?
Well, That's where you guys come in. If any entrepreneurs out there want to build that, I think that will be the killer unlock for this next generation of doctors who are coming to the workforce.
So it's almost like a managed service organization equivalent in for the Indian market, and you'll skew more inpatient because of the propensity to pay and because of insurance.
In time. So why I want this to be out there is that I know I cannot scale fast enough across this country if I'm building my own infrastructure. Whereas if I have the playbook and if I'm able to get a set of like-minded individuals and I can power them with everything, I can say, look, I may not be able to provide you a startup capital, but I can provide you with an unlimited pool of patients who will come. You take care of the delivery side of that, the care delivery part, everything else, the medicines, the CSST, the licenses and permissions, those we will help you get it done in a very easy to do way. So then allow us to scale much faster. So at this point, it's still very wishful thinking, but it's something that as an organization, we're moving towards.
So Viren, thinking about MSOs, the one specialty that we're very curious about continues to be oncology, right? There's no rocket science here, but interesting thing that we keep hearing is that 150 million Indians alive today will have cancer at some point in their life, and we don't have the infrastructure, ecosystem, care delivery built out for that, right? Like we now have for other specialties. What are your thoughts about building an oncology?
See, oncology per se, it is, so most Indians die of cardiac disease, right? That has reduced over time. Invariably, you live long enough, you will get some form of cancer or the other. It's just the trade-off as humans you make for, it's just a genetic structure. So everyone is potentially going to get some form of cancer or the other, but it is highly treatable, easily detectable, and there is worldwide many, many billions of dollars being spent on research, treatment, on protocols. So you don't have to worry about what happens if it's detected early. The issue that happens in India is just like with cardiac surgery when you started out, it comes with an innate stigma attached that people either ignore or they feel that if I have a heart problem, there's nothing I can do. They won't get treated. Today, it is harder for Dr. Shetty to convince a patient that he doesn't need heart surgery than it is when he started on his career that this person needed heart surgery, because it's gotten so much into the popular imagination that stent, valve surgery, heart surgery will cure your problem and then life goes on as normal. Whereas a lot of it can be managed with diet, exercise, medicine. So oncology will become that way. But it's not going to happen magically. We're going to have to put a ton of effort into making that. So today, the image that most people have, the popular perception of oncology is Tata Memorial in Bombay, where you see people with huge tumors, where you see absolutely end-stage cancer, you shave your head and you're weak and you look like a skeleton. That's what people think of cancer. That is not cancer. It need not be cancer. So it has to democratize a lot. Every hospital does a fair amount of work in oncology, in surgical, radiation, chemotherapy, but to become a retail experience, just like cardiac surgery, cardiology has become, that is something that any organization looking seriously in cancer needs to work towards, which is how do you reduce the barriers to people asking about cancer? How do you reduce the barriers for screening? And the things you have to do to make it seem not as scary and threatening and things that cause you to lose your hair and look like a skeleton.
Yeah. In our research, we also found that large number of patients will travel long distances for chemotherapy, and that's taking a lot away from life. It's taking away it's a hard part, and chemotherapy is largely driven in about 1,500 odd centers in India, which are daunting large hospitals.
See, the thing about living in India is that you have access to a time machine. That you just get on a plane and fly to any country in the West. And then you are 20 years in the future and you can see what is happening in medicine. And globally, chemotherapy, the infusion of chemotherapy does not happen in a hospital, or the hospitals do very little of it. Most of it happens in a clinic setting. It happens almost in a high street location. It is a retail, just like a normal out of hospital experience. It's done with a nurse It's done with the oncologist talking to you remotely. It's done with you sitting in a nice couch like this, browsing on an iPad while there's an IV line done, and you're just reading a newspaper, watching TV. You finish a session and then you go about your day. So if I were, going to extrapolate that this is what the future of chemotherapy looks like, that is something that I would invest towards. And that's something I know is a huge requirement for a large number of patients who come, who say, I'm traveling so far. Is there something you can build closer to the hospital, closer to where I live? But it's not easy, obviously. It's easier said than done. There are a lot of rules and regulations need to be followed. There is a huge amount of coordination that needs to happen. But fortunately, we've built a lot of the systems that can bring that same experience of hospital-based infusion to a place a lot closer to where people live.
Yeah. And especially if done in a MSO-like fashion where oncologists get to have a say, could be very appealing and could lead to an interesting patient-centric opportunity.
I agree. See, because there are many, many oncologists out there who are not necessarily affiliated with large healthcare groups. And they feel that they would give up some of their autonomy if they're affiliated with a large chain, even like ours. Like, I'd be the first to admit, we provide a great experience for a large number of doctors who choose to affiliate with us. But there'll be many doctors who say, I want to remain independent. I want the freedom to be able to practice anywhere, to be able to go to whichever hospital I want, or I want my own practice. So we're not speaking to them. And so for these doctors, if we can provide the backup of if something happens, if, during the insertion, there's some issue that comes up, or if they develop any complication, or even the post and pre-management, whether it's a radiation or post, if you require the surgery, will you be able to take care? And I'll just manage this episode of care, just the chemotherapy part of it. Do I have the backing of a large network to be able to work with? We'd say, yes, we want as an organization to be there for that.
Yeah, very cool. When you think about growth and innovation, right, there's a bunch of things you can do yourself.
Yes.
There's a bunch of things you can buy as a profitable long-term business. And there are things you'll partner for. Like, how do you make, what is your decision-making framework when we think about that?
First, buy to see if there's something out there. Regardless, like whatever it is that we want to do, whether it's like say a laundry service or whether it is some very advanced sort of service line that we want to build, first we'll buy. We will look out there and see, can someone do this? If no, then partner, which is find some like-minded individual, co-create, and we'll take some of the load, but they will do a lot of the heavy lifting. And if those two are not available, then do it ourselves. But it's always get someone else to do it. If not, partner with someone else to get it done. And if not, then do it ourselves.
How consistent is this framework compared to maybe some of your peers?
I think it's pretty consistent across the peers. I don't think generally organizations that have a very clear sense of purpose want to do everything themselves. I think just because today we're in a very network society and people are very hungry and willing to do the work. So I think this tends to be the default framework for most. But of course, there will be violations here and there. There will be some organizations that tend to be more empire building. And there are some organizations that say, you know what, they're so focused that they refuse to do anything and even buy an inferior product because they don't want to do it themselves.
Absolutely. Can you name like a couple of healthcare companies anywhere in India or the world that you admire outside of NH?
Yeah, I mean, many. So healthcare organizations have always admired what Kaiser built and what they've been able to do. Now, the thing also that the idea of Kaiser is much stronger than the reality of Kaiser. I'm sure if I start analyzing there a lot more critically, I'll realize the areas where they fall short. But for us, the idea of a thing, the idea of a fully integrated care organization was something very fascinating to us. United Healthcare is another organization we are deeply, deeply fascinated by. It's something that has proved they're going in they're coming to the same place, but from the opposite direction. As an insurance company, slowly moving into healthcare services. And they hire the largest number of doctors. They run doctor clinics. They're investing in ambulatory centers. So same idea coming from the other direction. So I'm, astounded by the scale at which they operate and, their ambition in doing this.
Yeah.
A lot of the startups as well. I would say that startups, even the ones that haven't, the Indian health tech startups, even the ones that haven't been maybe as economically successful or the ones that have questionable business practices, what we've learned from them a lot is that they have unlocked for us a customer preference that we didn't really know that customers preferred. So a lot of these surgical care startups, even though they are very questionable on the clinical ethics and the licensing or so on, they have unlocked, at least for us, this understanding that, okay, maybe the customer doesn't prioritize being operated in a large setup. They don't mind being done in a much smaller place, provided the experience is seamless end to end. So I admire the fact that they were able to get to that customer insight much faster than we could.
It's very hard to build, and it's particularly hard to build in healthcare, right? It's a slow to change industry. It's generally sometimes also non-trusting of outsiders, and I can say it as an insider. And what are some pieces of advice, like if you were to give like 2 or 3 to-dos or not to-dos to like budding entrepreneurs or people who are really passionate about going at healthcare hard? So
Yeah, I think I talk to a lot of entrepreneurs, and they run the entire gamut. There are these 22-year-old founders just gotten out of an IIT or a BITS, and they want to create something, all the way to people my age, in their 40s and so on, who've done the whole corporate path and they want to start something on their own. The one thing I tell them is, don't just copy what's out there. A lot of the time I feel, and especially I find that the older entrepreneurs tend to do this, is they are role playing as 22-year-old IIT pass outs with just the same copycat business model or this plus AI. I say, no, you see, in India, and this is particular only for startups based out of India, you can build just a regular business. You can just build a clinic. It doesn't have to be different in any other way. It doesn't need to be e-clinic. It doesn't need to be an AI doctor that you don't even need to build the clinic aspect of that. Build it in a format that the most number of your customers, who are more likely to be your parents or grandparents, can recognize as a place where they can get some service rendered. But the multiplier, the thing that makes you different, the thing that makes you a startup, is that you see what levels of digitization or tech needs to be built to make it just 10% better than the next person. And that's it. Like, that differential will compound for the rest of your life. You don't need to spend years, sometimes decades, raising VC money, just burning series seed all the way to series F to be able to prove something that the market never asked for. Yeah. See, what is the struggle for product market fit other than your customer telling you from day one that I don't care what you have. I don't care for it. I'm not going to pay for it. I'm not going to pay what you're telling me it is worth. What I'm saying is that you want to build a business that scales. You want a business that does tech and digitization and does, this transformational growth. It's just the normal business with tech applied to it. Yeah. And so that's generally the vein of advice that I give. Not to say that there is no role for transformative innovation. There's no role for this completely reinventing the wheel. That does exist, but the failure rate for that is phenomenal. And a lot of people will simply not have that kind of runway, or those deep, our country doesn't have those deep pools of capital that Silicon Valley does. So it doesn't make sense to role play a Silicon Valley founder in India.
Yeah. Is there I totally resonate with that. And is there a sector or space within healthcare that you're like, this is going to become very big in the next 10 years and like maybe hard to build, but probably worth building here?
So those are two different things. One that will become very big and one that's hard to build. I think the predictable path for success in healthcare is just healthcare services with a tech frosting on top, where it is not frosting, like it is innately part of the core ops. So I would say that even if you're doing clinics, even if you're seeing patients, even if you're transporting medicines from one part of India to the other, I think the stable, predictable, large businesses in Indian healthcare can be built doing what has always been done, but doing it much more efficiently with technology. But the transformative, the things that will be world-changing, I think that will be in completely reimagining the entire healthcare value chain. I think maybe there's an AI flavor to it. Maybe there isn't. The thing is, I cannot even begin to envision. Like, I'm trying to take the safer path because, we already have an established organization. We're going with a steady vision. I think the thing that will completely disrupt this probably is some kind of AI doctor that will, make all the decisions, and then the patients will completely undercut everything else. In which point, you just end up getting prescription, you fulfill it yourself. Or if there's surgery, then you get to go directly to the doctors, and you won't need a healthcare organization to have any of that. It would just fully disaggregate the model, and a healthcare organization would not exist. It would just be a bunch of freelancers providing services that the AI tells them to serve. So maybe that can be built. Who knows?
What are the, thinking about the next 10 years, what are a few things about healthcare that you think will be true 10 years from now? It's not true here today.
I want to believe that this model of integrated healthcare, which is insurance plus provider, will be the norm 10 years from now. Right now, these are two very different paths. I want to believe that we move away from a fee-for-service model where you're just reimbursed for more that you do towards one where it's value-based care, where it's group purchasing, where you collect a group of people, you get a lump sum of money, and you take care of people with that. I want to believe that is the direction that we go. It doesn't seem to be the case. So we're making a big bet on it, on the hope that we can, bend the cost curve a little bit. Maybe we're successful at it, or maybe we're successful for a small group of people. That is one direction I would like to see the healthcare industry move. One direction that I know the healthcare industry is moving towards is just orders of magnitude more healthcare utilization. I think what COVID has taught us is that as a society, the whole planet got together and decided that our health is more important than going to work, than running the global economy. And we want to take care of ourselves first. And so we just stopped the world to be healthy. And so that was a group decision. All of us participated in. We all agreed health is the most important thing. Now, what are the things you do for being healthy? You need to access a lot more healthcare, a lot more proactive screening, a lot more interventions, a lot more health embedded into every single thing. Health embedded in your watch, in your phone, in your life, in your phone calls, in all of that. I think it just becomes more part of the conversation. So I think in 10 years, we will all be thinking much more actively about our healthcare than we do right now. And I think that we will all be a lot more aware.
Absolutely. Well, this has been incredibly enlightening for me. So thanks a lot for patiently answering a lot, a barrage of questions. And honestly, for us sitting on the sidelines, it's truly inspirational what Narayana has done, not over the last 3, 4, 5 years, but for decades. And I feel the best is still to come. And so congratulations and thanks a lot.
Thanks, Pankaj.
Take care. Thank you.
Thank you.